Dr. GrGarimaAsati. Welcome you all in my YouTube channel. Friends, today I'm going to explain you about the diagnosis of all the varieties of arthritis, what we have discussed earlier in the arthritis series, through their symptoms. So what are the symptom differences between the arthritis, gout, rheumatoid arthritis and osteoarthritis? So we'll see these in this video. So let's continue with the comparison between all these four. Before that, if you have not subscribed my channel till yet, kindly subscribe the channel, tap the bell icon to get the latest update of the videos. So let's continue with the comparison, and in that first we'll talk about the arthritis. So the first arthritis is the acute variety of the inflammation of the joint, especially if it gets chronic, then it can lead to gout, osteoarthritis or rheumatoid arthritis. So all the 5 inflammatory signs can be seen in this arthritis, that may be redness, swelling, heat, pain or tender to touch, and restriction of the joints get stiff. And along with that, poor sleep, muscles weakness, fever and malaise can also be seen. Next is gout. So it especially affects big toes, along with it heels, ankles that is, and knees, wrist, fingers all gets affected. But in this, uric acid crystallization, that is deposition of uric acid crystals, takes place within the joint spaces and in kidneys too. So if it is in joint spaces, then it is termed as tophes, and if it is in kidneys, then it is termed as renal calculi. So uric acid crystallization is gout. Along with it, high-grade fever and malaise is also seen within this gout. Next is osteoarthritis. So in this, wear and tear of bones takes place. So in this, there is also swelling and the stiffness, but it is more after prolonged period of any work, prolonged activity, and it gets ameliorated after rest. And this stiffness is more in the morning after an inactive prolonged period, and even after doing prolonged work, it gets increased. Crepitus or crackling sound may be heard during the movement of the joint. Joint locking takes place in this osteoarthritis. Bony enlargement can occur in this osteoarthritis. So Haberden nodes can produce or form at distal interphalangeal joint or at proximal interphalangeal joint. The nodes which produced or formed are Bouchard's nodes. And the last is rheumatoid arthritis, which is an autoimmune disorder, that is a process of self-destruction. And in this, all joints may get involved. Along with it, there may be synovitis, that is inflammation of the synovial membrane. The stiffness is more in the morning, even after prolonged activity too, and even after prolonged inactivity too. So it gets ameliorated from the gentle movements only, and it is a symmetrical disorder. Some deformities may also occur in this rheumatoid arthritis are ulnar deviation, swan neck deformity. So the hyperextension takes place at proximal interphalangeal joint, and flexion occurs at distal interphalangeal joint. This is swan neck variety. And the opposite of this is buttonhole or buttoneer deformity. The proximal interphalangeal joint bends towards the palm, and the distal interphalangeal joint bent backwards towards the back of the palm, and this is buttonhole deformity. Other body parts may also get involved in this rheumatoid arthritis are lungs, causing lung nodules, skin gets involved, causing cutaneous nodules, heart may get involved, causing MI, increasing risk factor for the cancers, and many more body parts gets involved. That's all about this topic. We'll meet soon with a new topic, new subject. And The clinic address of mine and the contact number is given in the description link of this video. Stay connected to stay healthy. Thanks for watching.